real relay.
Yep. Okay, so who has the schedule? We grab the schedule. Yeah, grab a few, so Dr.
So Brittany would enter the patient's medical history. Where do I pull that up on the patient?
So if there's an alert, you'll see this right here,
Mm-hmm.
and you can also see that
Jen bring
right here.
Jen bring you.
Okay.
It's not a real patient, so that's why.
Oh,
But then also you can see it.
You didn't know
Patient. You can click right here
yet.
because you have to sign their health history.
Okay.
Let me show you what's actually filled out. Okay, so you click right here, and then you can click right here, and there's a check mark, so you know it's actually there.
Okay.
And then to sign, you would click right here, signatures, and then like this one doesn't have a doctor's signature, and then you would click, and then you sign and press OK. To read it, you just click on it, and then it's right here on the side. And you can go through it like this.
What about like their meds and stuff? Do we put that in or anything they're taking?
You guys have the
Yes.
health history open up.
It'll
when the doctor
be-
comes to the room for new patients.
It'll be right here,
Yes,
well,
yeah.
because it says, are you currently taking any prescriptions?
Uh-huh.
So it'll be on this page, we'll write them all
They
down.
just reopen it.
And then
Yeah, because we're
if
taking.
there's any allergies or high blood
so you need to
pressure,
close it.
then we will put it
But we don't open it.
in here.
We don't open it right after.
No, the X-ray's open, right?
Usually they sign in the room,
Yeah.
Like before they come in to see the patient.
yeah, that they should go over it.
You've been doing that.
And if there's any,
Like in those rooms have a signature tab. Yeah, go over to
Sometimes we don't really have time to be in a room.
There's another one.
This one in that case.
Okay, so we should talk about this. So where do you usually review the x-rays?
I do it if I could do it in every
In the
room.
hallway, in the room and the hallway? So we have a secret pattern?
Well, because that's clear.
So it's just that one and then I click on dental history and then
So I
go over
usually
everything.
Right.
So they click on it, right? Or you,
Oh, that's still
or do you fill it out for them?
I fill it out for them.
You fill it out for them?
Yeah,
Okay.
so you need to just sign and then review it and then sign. And if there's actually an alert, like their normal patients, you'll see this and that will tell you that like this person's allergic to latex.
We have a question. We should have an agreement on when the doctor signs the health history form, because right now,
I'm not really signing it.
Okay. Is it, can we have that screen up? Kind of like Thomas Road?
And the office policy and the general consent form they send you.
Okay.
So we have to sign 3 of that.
And you do that by right here. And then click sign and then you sign.
Once there's a sign, is everything signed or? do I
No,
go
you have to
into-
go through each
Okay.
one.
Oh, and that's when the mark goes on.
Right, so you can highlight it. So that would be that one, and then you click right here. And then sign, click sign, sign it.
but you say when the x-rays is up after you check it, then that screen is not there.
No, they don't sign in the room. At least I've never seen a doctor sign in the room.
Well, is there a sign pad in the room?
Yeah, that's a senior pet along the hallway. Right?
Yeah,
Did you?
yeah, and we have extra
I
ones too.
think
if
in
we
that
need-
room too has one.
Mm-hmm.
The office.
How about we keep it in the lab or in the hallway?
Like where would you most commonly be as you're waiting for the new patient to get processed?
If in the middle of the procedure, I'll
Be in the room.
not be in the room, but
Yeah.
if I'm in the room, I would be reviewing the x-rays because I can just click 5 of that and see.
Okay.
I know like Dr. Choi,
Mm-hmm.
he's really good at this. He always, because I've already gone over the health history when I start taking x-rays.
Mm-hmm.
And so and he always reviews the x-rays before he comes in. So then during the time I'm taking the x-rays, if he's free, that's when he'll sign the health history.
That's good. So maybe before or after the visit then? Right. Because during then, once you take the x-ray or when you come in, it takes a couple minutes, would you say?
Yeah,
a-
so
a
once you
good-
see me taking x-rays, it means I'm done with
Mm.
the paperwork.
Okay.
Okay.
All right. So maybe once you start taking x-rays, before you come in the room, you're reviewing
And
it.
if I don't have time, then I'll just do it after.
And
But
then
have to review it first though, the signing can be later.
Yeah.
and the assistant tells you if there's any.
Yeah, medical problems.
Yeah, exactly. Okay. Good, so we have, Dr. Chow is gonna see Alvia.
So, do, like the huddle?
Yeah, we'll just go over quickly.
So
and
first
we'll assign.
patient's going to be Ovid. We're gonna be doing, 3 fillings, 15, 19, and 20. He has, 1, 2, and 5,
16.
and 16 filling pending. And has, gum treatment scheduled for April 4th, which is tomorrow. Okay, and who will take that patient?
Brittany.
So usually we write it down in the WhatsApp, and then that's good. And then we have, new patient is Angela. Angela, we're gonna be doing, comprehensive exam, full mouth and prophy. Has no main concern, just general checkup, has no history with the insurance, has full remaining of 2,500. Do keep in mind that preventative, it doesn't go against his, 2,500. Next page, Brittany, this one, or Dave?
David's gonna, you a full day, so you need to take a lunch. When is, and you can take this next version,
Which one?
the next one, that's what we're talking about.
Angela?
Yeah.
So David?
So we're gonna be done with, Desiree, and then you take lunch right away. Yeah. And then it's gonna
So
happen.
I'm taking
So
x-ray.
should I have her do one?
I'm taking x-ray.
Today, one patient? Or do you want her just shadowing for the
I
two,
can-
for the next two patients?
Actually,
For today?
For me to shout in.
Ciao.
So I'll take this one.
I should bring, you're right, that's a good idea, to take that one, because I wasn't sure how the doctor would be able to finish it right here.
So Brittany?
Yeah.
Brittany?
And that takes a day.
Okay, so hey, we're gonna be doing comprehensive full mouth, prophy, no main concern, has $1,500 with the insurance, has no history with the insurance. David and me will be taking that. And then next patient is, Aravind. Aravind, we're gonna be doing a prophy, filling number 2, 3, and 14. And has, number 18, implant pending, see if the patient's interested. And we need to schedule for next recall.
David, you took that last.
Very good. David.
Okay, so, so we really committed about training and get a chance to practice on patients. And one reason why we should do that is our reason we talked about. So I want to recognize Brittany because you're actually going to be working 6 days this week. Today's your day off. So for our team members, we don't work 6 days, only when it's rare cases. But today, because we're all here, that's why I want you to have the opportunity to be part of the team and the training. Plus, I'd like for Dr. Chong to practice what we learned today too. And so you need an assistant to do that. All right, so that's why she's here too. And so Okay. So I'd like to hear from the two doctors, what would you like to accomplish on these two new patients? And think about what we trained today, pick one thing that you want.
Coming to treatment, start treatment.
Awesome.
I wanna, be able to do the whole exam smoothly, because sometimes I have to remember to use the camera and stuff, so I just wanna get all my steps together and make it flow.
Okay. Sounds good. I can spend a little bit of time with you on that right after that patient there. That's all right.
So Brittany's leaving at 4.
Mm-hmm.
So who's taking Angela?
I am. I'm taking the first 2 patients.
So if that's the case, how about Dr. Chow continue with that next patient? And that gives Dr. Trong a little bit more time to practice on the camera. And then you take the next to Suge. Suge.
So Suge with Dr. Trump, the first session.
What do you think? You comfortable with that? Okay. And then David will be with Dr. Trump on Suge. So if that's the case, then you'll be free between 3:10 or so. We have about half hour free. We set up for the next 2 rooms. Yeah, and just get it wrapped up for the day too. All right.
Okay, so we got just a minute and a half. Dr. Chung, would you read this review for us? This is from the office one. Start from here. Yeah. And just think about 1 or 2 things that ties into what we talked about at the beginning of why we do what we do.
I was born and raised in the same town for 20 plus years, which means that for over 2 years, I've been going to the same dentist. It became quite obvious that I needed a new dentist once I moved to California, as I can't afford to fly back to my hometown for every dental checkup. I turned to Yelp and found a place close by to home. After I had made the appointment, my coworker recommended me to her dentist, but being as lazy as I was, I shrugged my shoulders and said I would go there the next time after my initial checkup. How wrong I was. The people at Perfect Smile are ridiculously and amazingly friendly. They greet you with a smile and there's virtually no wait time. I think I waited a total of 2 minutes, which is a record for me. The administrative and support staff are very understanding of my needs and preferences. They also have some advanced tools to make your entire dental visit more amicable. My dentist, Dr. Choi, is the bomb.
Can we get that again?
My dentist, Dr. Choi, is the bomb. I'm used to more of the old school kind of healthcare, which means in and out quickly, but also with a bit of borderline pain. So when Dr. Choi was giving me a thorough explanation of everything and such a gentle administration of the Novocaine that I didn't even know I was getting it, I was more than blown out of the waters. Did I mention that I got to watch The Avengers as I had my tooth prepared for a crown? It was originally Apollo 13, but then I realized it is a thriller, and the staff was kind enough to stop their work and change the movie in the middle of the crown prep. If you haven't gotten the hint yet, then let me say it point blank. This place is wonderful. Ask for Dr. Choi and you won't be sorry.
So one point I want to make is when Dr. Choi came on, we did all this stuff. And it was really uncomfortable for him because he's like, man, I don't want to practice and do all this stuff. And we actually got up in the morning and we run at 5 a.m. too, me and him. And we're like, we got to get this thing right. This is our vision. And after like, what, 2-3 months, you saw that, right, really? I mean, he was like non-existent on the internet. I mean, nobody knew who Dr. Choi was, even though he was practicing for like 7 or 8 years. And now, review after review after review. You know, and same thing for you, right, David? It was very uncomfortable in the beginning.
Yeah.
You're like, new patient tour, I don't know how to do this. And so I expect a little bit of just uncomfortable, you know, as we practice these things. You know, after each of the patient, you guys get together and talk and say, what do we need to change, this and that. But the results are really easy. So I'm really excited about that. So the word for the day will be practice. Yes. 1, 2, 3. Practice.
Great
Hi
job,
everyone,
team.
have a good day.
Have a good day. Thank you for the training.
Yes, and we have 2 more sessions. Yes, okay, so.
Usually the little could put their sign. Just have these insert the camera, we can move that so we can.